Hi, I'm David with the Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including pain management doctors and clinics, chiropractors, and physical therapy practices. Today, the topic of discussion is intra-articular knee injections for arthritis. Arthritis affects 30 million Americans, and that figure continues to rise as the population rises. But arthritis of the knee is one of the most common areas affected. And that may be from regular wear and tear arthritis, which is called osteoarthritis, or it may be from someone who had a trauma, such as a car or motorcycle accident, a basketball injury, mountain biking. Any one of those things can lead to a cartilage injury and arthritis that ensues. So the objective is to avoid surgery on one hand, but what if the medications by mouth like naproxen or ibuprofen, Advil, if those aren't quite cutting it? And then you have some physical therapy options, weight loss, exercise, things like that. What's in here that can help you avoid surgery? Well, bracing can do that, but intra-articular knee injections have worked well for decades. And the gold standard among those is steroid injections. And that involves corticosteroid, which is a huge anti-inflammatory medication. And usually it's something like Kenalog or there's other brand names. But they can be done every few months and can work extremely well for pain relief. Now, the studies show probably 80% on average pain relief, so very good efficacy. But there are some risks associated with steroid medication, which are low. But for one risk, we don't know for sure if it causes damage to the cartilage. It does in animals, that's been shown, but we don't know if it does in humans. So that's a theoretical concern. But one of the newest medications that's now being used for knee arthritis injections is called hyaluronic acid. So in order to spell it, just look in the description of the video. I'm just going to call it HA injections. All right? HA is a substance that is normally found in your knee fluid, the synovial fluid, and it's analogous to motor oil. It's a lubrication between the cartilage that can help provide safety for the joint and pain relief. And the HA injections that have been formulated don't come from somebody else, another human. They actually come from rooster combs from animals. So it's amazing the way they found out that that was a good source of it, but it has shown very good results. Studies have shown that overall HA injections after a year in the research have been 65% good to excellent. And for a very low risk procedure, that's great. That is really good. Additionally, there are multiple formulations. There's ones from Synvisc, Hyalgan, there's other companies, I think Orthovisc. They're all kind of the same type of thing, but some involve a one-time injection, others involve a series over 1 to 2 weeks apart, like 3 to 5. And they actually had started to look at some of these against each other in the research, and the initial research showed that there was really no difference. Now there's been some new ones since that research was done. There's also some new research looking at injections of steroid intermixed with HA injections, and that's actually showing some good results. And then another study has looked at ketorolac, which is a non-steroidal anti-inflammatory injection intermixed with the HA injection, and that's what's showing good results as well. So it's very exciting because let's say you're in your 30s and 40s and you have post-traumatic knee arthritis. Getting a knee replacement is a terrible idea. Way too young. Even in your 50s and early 60s sometimes, it might be too young. But, so these should be exhausted before you go to the last resort, which is the knee replacement. Pain doctors in Florida in the network do provide knee arthritis injections. The website is floridapainnetwork.com. Push "I need a pain doctor" and then put in your zip code. It'll show you the pain clinics that are closest to you. All right? Thank you very much for viewing today. I'm David with the Florida Pain Network. Your pain stops here.